Stem cells are special cells that can be found in very limited quantities in different parts of the body. These cells have the ability to differentiate into some cell types. Blood stem cells are able to differentiate into white blood cells, red blood cells, and platelets. These cells can be obtained from peripheral blood, bone marrow, or from cord blood. Since the first cord blood transplant in France in 1988, the number of transplants has increased dramatically. Since 1988, the number of diseases that can be treated by cord blood transplant has also increased dramatically. In some countries, there are already more transplants using cord blood than using bone marrow. In the future, more diseases may be treated using stem cells, including spinal cord injury, heart disease, cystic fibrosis, diabetes, and Alzheimer's disease. A cord blood transplant works just like a bone marrow transplant. The patient is given a high dose of chemotherapy or radiation therapy to treat the disease. Stem cells from bone marrow or cord blood are then introduced into the patient to reconstitute his immune system. Cord blood has a number of significant advantages compared to bone marrow. Collecting cord blood poses no risk to mother or child, whereas a bone marrow donor must undergo general anesthesia and there is a risk of infection. Collecting bone marrow is a painful and invasive process. Collecting cord blood is painless to the mother and child and is usually over in a few minutes. Cord blood can be stored in a cryogenic freezer ready for use when needed. Bone marrow is collected only when needed, and it may take many weeks or months to find a suitable and willing matching donor. Transplants using cord blood carry much lower incidence of graft versus host disease, a condition where the graft fights the body. There is also a lower chance of the body rejecting the transplant. This makes it possible to perform transplants with less than a perfect match. Cord blood may therefore be used more readily. It is believed that the biological clock is stopped for cord blood in cryogenic storage. That is, protected from damage due to environmental factors, age, and viral or bacterial attack.